Gentlemen, a very warm welcome to the National Robotarium. I see some familiar faces, so for those of you who have been here before, welcome back. And those who haven't, hopefully you'll learn a little bit about us this morning. Obviously, I'm not the main attraction, but I have been involved in the National Robotarium for around 3 years now. My name is Stuart Miller, and I'm the Chief Exec of the National Robotarium. And it's been my privilege over those 3 years to lead a team and a group of people who are not directly in my team to build the National Robotarium and make it what it is today, a place that involves over 140 people on any given day, researching, developing and producing new products and helping industry and other organisations like the NHS and the various aspects within the NHS look at robotics and AI as a new technology which can help improve things. And to do that, we do a number of different things. So it would be remiss of me, on behalf of everyone who works here, not to just take the opportunity to tell you a little bit more about the National Robotarium this morning. So if you bear with me for a couple of minutes, and then I'll hand over to the Cabinet Secretary to talk a little bit, and then the First Minister. But as I say, very warm welcome to all of you. We've been working very closely across multiple sectors with different types of organisations, be they manufacturers, logistics warehouses, farmers, hospitals, hotels, etc., right across the economy. But today I just want to talk a little bit about what we've been doing in health and social care. Behind me are some labs that specialise on human and robotic interaction, and that tends to look very closely at how to help people with robotics at home for social care and in hospital settings and in residential care settings. So there's a lot of work being done here in that sphere, but also my team is focused very much on the practical end of delivering those benefits into hospital settings, residential care settings and care at home settings, and trying to make sure that this emerging technology, which is moving incredibly quickly and has huge potential to benefit society and grow a part of Scotland's economy, is capitalised on and used by everyone as best it can. And that's really what we're here to try and do. And to do that, we've been working on everything from simple cost and efficiency measures, making sure that hospitals could be kept clean and tidy, that goods and services could be delivered more efficiently, but also that nurses, doctors, physiotherapists have assistant robots in the future, taking some of the workload and making it easier for them to bring their skills to bear and maybe some of the more mundane tasks being done elsewhere. And in social care, particularly care at home, there's been a lot of work done here looking at how to help people with the loneliness that can come with that, but also the practical help to try and make that a 24-hour, 7-day-a-week support, not just an as and when it's possible to make a home visit type of support using robotics and AI. And as well as having those kind of conversations which have led to high-level conversations with the government around how to apply all of this across the NHS here in Scotland, but also more widely in the wider NHS in the UK, we also have been supporting a number of startups. In the building today, we've got around 14 startup companies, all working on different robotics products and services. And 3 or 4 of those work specifically on healthcare and social care. To my right here, BioLiberty work on a recovery device for stroke patients, and have just recently shipped 20 devices to the US for evaluation. So they're very hopeful that they'll start getting traction there and be delivering the devices very soon. We've also got Metacarpal, who are developing a robotic hand for those that need a replacement hand, and taking some quite novel approaches to make that robust and very cost effective, and they're about to go into low rate production as well. We have Companion, who have been developing an assistant robot that helps people who are living on their own to have some companionship, maybe not in a position to look after animals, but gives them the same kind of affection and the same kind of feedback as an animal would do, while at the same time recording data to help with understanding both the physical and mental health of the patient. And then finally, a thing that's close to my heart is making sure that we help everyone in the public, but particularly young people, to understand the potential of robotics, whether they get involved in it as a career, which we would prefer, but even if they don't, become educated and aware of what robotics and AI is going to mean for them as they mature and live their lives here in Scotland. So we're really focused on those 4 things: helping businesses, organisations like the NHS take on robotics, helping start-up companies bring new products to the market and grow the economy for Scotland, helping people to live healthy lives at home and in hospitals, helping young people to understand robotics, and assisting and promoting research to make sure that research pushes forward to the next generation. So with the importance of robotics and AI, the importance of health and social care, that intersection is, I believe, really important. And so hopefully, those of you who know us will continue to talk to us. Those of you who don't will reach out and we can get to know each other a little bit better. And we can do something that helps Scotland not only benefit in terms of its health service, but also benefit in terms of its economy by really embracing robotics and AI. So with that, I'm going to hand over to Neil Gray, Cabinet Secretary for Health and Social Care.
Thank you. Thank you very much indeed, Stuart. It is my very great pleasure to welcome you all here to the National Robotarium, and thank Stuart and his team for hosting us today at a site which I've been able to see myself over the last couple of years is a site of innovation, of discovery, a facility that faces the challenges as well as the opportunities that there are of the future with skill, with purpose and with optimism, and which is apt because today, in line with his key priority of improving our public services, the First Minister will outline our plans for a renewed, refocused and reformed National Health Service. This work that will only be fully realised with close collaboration and coordination between health and social care services. And for that reason, it's so good to see so many of you from across those essential and valued services here today to hear more of the details of the Scottish Government's plans, the First Minister's priorities and the NHS renewal framework, an important document which is published today. Important because through it, and empowered by the record investment outlined in the budget for next year, we can realise further progress in our vision for the renewal of our health and social care services, a vision which I set out to Parliament last year. That vision remains one of enabling and empowering the people of Scotland to live longer, healthier and more fulfilling lives. And it is still a guide to the work which we and the whole system, and with the spirit of collaboration in mind, are doing now. The budget and the framework, as the First Minister will set out in more detail, works towards that vision by supporting plans that improve population health, focus on prevention and early intervention and provide quality services and maximise access. And so it is my great pleasure in that vein to welcome and introduce the First Minister of Scotland, John Swinney, MSP.
Thank you very much, Neil, and Stuart, thank you very much for that fascinating explanation and about the opportunities around the National Robotarium, and we'll talk more about those in the course of the day. So good morning, everyone, and thank you very much for joining me here today. I had the opportunity earlier on today to tour the Scottish National Blood Transfusion Service's Jack Copeland Centre. The centre is a great example of the NHS at its best, with the latest technology being used to meet the transfusion needs of all patients across Scotland. The transfusion service is also home to groundbreaking research related to blood and donor tissues and cells, as well as trialling new advanced therapies. So what happens there both provides care and improves it, and there's an important metaphor for us in what I'm going to talk about today. I'm looking forward also after this speech to learning more about the exciting work going on here at the National Robotarium. My appetite has been whetted by an article written last month by the Robotarium's Business Development Manager, Lisa Farrell, who's here today, on the potential for robotics to modernise our health service. Lisa highlighted cases here in Scotland, such as automated porters and robotic pharmacy assistants, where this modernisation is already happening and taking place within the National Health Service. She spoke of the potential for robotics to ease the pressure on our workforces, to give staff more time to devote to the aspects of care that do require a human touch. And she pointed out that achieving the full potential of such innovations requires coordinated action and strategic investment. And I couldn't agree more. It's against the background of the research and innovation that goes on at these two centres that I want to speak to you about the most cherished of our public services, the National Health Service. The NHS is stitched into the very fabric of our nation. It is part of who we are in terms not only of the care it provides at every stage of our lives and the lives of those we love, but also because every single family in Scotland will have someone or know someone who works in the National Health Service who devotes their life to this service. Like all of us, the National Health Service is personal to me. I see firsthand all that it does and has done for my own family. In the last years of my beloved mother's life, I saw such care and attentiveness in the community and in hospital care. My wife would not have the capacity and the capability she has in dealing with MS had it not been for the outstanding care and insight of the National Health Service, alongside, might I say, her absolutely personal determination to stay strong. I would not have had such joy in my life at the birth of my 3 children without the National Health Service. So it's personal for all of us. That's why we care about it so much. That's why we all want to see it thriving once again. We all know the tremendous pressures our NHS has been under in recent years. We see a service still reeling from the strain of a global pandemic, a pandemic that revealed the NHS's many strengths, but also exposed its underlying weaknesses. Weaknesses made worse by a decade and a half of austerity and by the body blow of inflation that has meant, as we know from our own family finances, the available money delivers less. It's a service still beset by backlogs and delayed discharges and struggling to meet the increasing needs of an ageing population. The challenges are great, of that I have no doubt. But I know also that our NHS is fundamentally resilient, fundamentally robust. I witnessed both these realities earlier this month when I spent a Saturday evening visiting the emergency department at the Royal Infirmary of Edinburgh. In the midst of both winter pressures and a particularly challenging flu season, I saw patients who waited too long to be seen, but also staff who went above and beyond. I saw an NHS that in the face of the storm kept on standing, kept on delivering. There are some who oppose the NHS model, who believe that the answer to our health challenges is a privatisation of care. They want us to believe that the health service is beyond saving, that it is on the point of collapse, but that is simply not true. There are challenges. Some services are struggling. Periods of real crisis, as we've seen in recent weeks as flu cases spiked. The impact of these issues on too many patients is real. But as I will set out today, there is nothing wrong with the National Health Service that can't be fixed by what is right with the National Health Service. What is right with the National Health Service includes the thousands of health and social care staff who are doing phenomenal things under enormous pressure. People who, time and again, display resilience, selflessness and grit, who truly go above and beyond. It includes innovations such as the Rapid Cancer Diagnostic Service, a new pathway that delivers significant reductions in the time from referral to diagnosis, opening the door also to faster treatment. It includes national public health initiatives like the HPV vaccination programme, which has resulted in no cases of cervical cancer in young women who have been fully vaccinated, a remarkable, utterly remarkable life-saving achievement. And it includes cutting-edge research, multiple projects, looking into the ways AI can transform diagnosis and treatment in the years to come. The foundations on which we will build NHS recovery and renewal are strong. Under this government, the NHS will always remain in the hands of the public and free at the point of use. That is non-negotiable. The question then becomes, how do we do better? How do we ensure our health service is not just the best in these aisles, but the best it can possibly be? The answer to that question is not a simple one. There is no magic bullet. Rather, it involves progress across multiple fronts, a balancing of sometimes competing demands and interests. It will require choices and action by central government, yes, but that must be delivered in partnership with others: local government, the third sector, patient groups, and crucially, health and social care workers at all levels. It must deliver reform that is fundamentally patient-centred, but do so through a health and social care system that becomes an ever more interconnected whole. I've said before that my approach as First Minister is to seek the right solutions, not merely the quick ones. I favour consensus building and collaboration over diktats from on high. For the future success of our NHS, this is not only the right approach, but the necessary approach. We will only succeed on this path of reform and renewal if we walk it together. That's why the Cabinet Secretary for Health and I meet regularly with staff in all parts of the National Health Service. It's why we've been engaging with health boards, local government, health and social care partnerships, the Scottish Ambulance Service, Public Health Scotland and NHS 24. We've listened carefully also to patients and their families, to all those who depend on the NHS for life-saving, life-enhancing care. We've been told all that is going well and all that must be better. We've heard the advice from those with direct frontline experience, and that's helped us to develop a clear understanding of where the challenges are and what changes are needed. It's this kind of open, collaborative approach with a focus on solutions, on the right answers over the easy ones, that has led to the actions I'm setting out here today. It's a set of actions with clear outcomes, tangible improvements that we can and will deliver. Tangible improvements to make people's experience of the NHS in Scotland better than it is today. Actions made possible by the record funding we are delivering to the NHS frontline. Actions that will address the immediate issues in our health service, those problems of access that I know cause so much frustration and indeed for some unnecessary pain. Actions that set out a new course so we can safeguard the NHS for the long term. Over the coming weeks, the Government will set out for Parliament what the different elements of our approach will mean in practice. And we will be reminding members of Parliament as we do that. So that the delivery of the stronger NHS depends on the safe progress of the draft budget currently being considered by Parliament. The actions we will take to deliver a more accessible, more person-centred NHS have three clear purposes. First, to reduce the immediate pressures across the NHS. Second, to shift the balance of care from acute services to the community. And third, to use innovation, digital and technological, to improve access to care. Together, these will address the problems that right now, every day, weigh down our National Health Service. They'll begin to deliver the long-term, systemic improvement that is needed to ensure our health service is sustainable for the future. And they will make it easier for people across Scotland to live healthier lives, helping us to build a future in which health is practised in homes and communities as much as it is practised in surgeries and hospitals. So let's talk first about those immediate problems, the crises facing too many parts of our National Health Service. The first and most important thing on many people's minds is how long it can take to access services. Delays in access with waiting times that are too long and delays in discharge because appropriate at home or in community care is not available. The two, of course, are fundamentally connected. Last year, I referred to delayed discharge as the canary in the coal mine of our National Health Service. I think of waiting times in much the same way. Both these delays tell us that the flow of people through the health system is not happening as it should. Put more simply, people are not getting the right care in the right place at the right time. That's not acceptable to me, it's not acceptable to my government, because it can lead to people getting sicker as they wait, and it can mean they can take longer to recover. It adds substantially to the stress that they and their loved ones experience. It creates greater strain across the system, leading to more delays elsewhere, poorer outcomes for others, and still further stress on services. It is the very definition of a vicious circle, and it has to come to an end. So today, we commit to a substantial increase in capacity in order to significantly reduce people's waits. The changes we propose, including an enhanced regional delivery model, alongside increased levels of activity in our national treatment centres, will deliver over 150,000 extra appointments and procedures in hospitals and in communities in the coming year. That includes 10,000 extra procedures through smarter working in the national treatment centres. Other sites, including Gartnavel, Inverclyde, Stracathro, Perth Royal Infirmary and the Queen Margaret Hospital will deliver 9,500 extra cataract procedures, as well as 2,500 extra orthopaedic appointments and procedures, operations such as hip or knee replacements. In this way, we will create centres of excellence, places of expertise and specialisation where we will be better placed to capitalise on the technological innovation and the potential of AI. And we will cut our waiting lists. Cancer referrals, gynaecology, ophthalmology, orthopaedics and radiology all benefiting from this new investment. Centres able to deliver more care, more quickly and more efficiently than traditional, smaller, more fragmented facilities, with transport support provided for those who need it. And to ensure that they do, we will put in place clear milestones and targets for those specialities that add the most to our waiting lists. Our second focus will see more and better care delivered in the community. I spoke earlier about the importance of people receiving the right care at the right time, in the right setting. That right setting will always be the least intensive setting appropriate to the person's needs. Sometimes that appropriate setting is in hospital. More often, it is not. So to strengthen and renew our NHS, we will shift more care into communities and into homes. As much as possible, people who do not need to be in hospital will not go to hospital, protecting those acute services for those who absolutely need them. This new approach will mean changing the way we deliver acute services. By this summer, we will have specialist staff in frailty teams at the front door of every A&E department in Scotland. This will mean that frail patients, often older patients with complex needs, will bypass our busy A&Es in order to receive the specialist care and support that they need, whether in hospital or back at home. It will mean better care for these more vulnerable patients, whilst reducing the pressure on our A&Es. Our actions will also improve the NHS's capacity to treat people at home. Our Hospital at Home initiative, which allows hospital levels of care in a person's home, will be expanded to at least 2,000 beds by the end of 2026. Without the need for any new bricks and mortar, the effective capacity of every single hospital in Scotland will be expanded. Taken together, it is action that will ease acute pressures, reduce delays, cost less to our NHS, and most importantly, help people get better more quickly, more comfortably. Quality care for thousands of Scots delivered not simply close to home, but at home. Of course, we cannot simply shift services out of acute settings. We also need to build capacity in our primary care and community health settings. With this in mind, the Government has been listening carefully to the views of Scotland's GPs. They've described the multiple contributions general practice can make as we shift to more community-focused care. They've argued that GPs must be given the resources they need to fulfil that role. We've listened and we've been persuaded. As a result, our plan will ensure that a greater proportion of new NHS funding goes to primary and community care. GPs and services in the community will have the resources they need to play a greater role in our health system. This increased investment will result in GP services that are easier for people to access. That's important in terms of people's confidence in the health service. Indeed, difficulty making GP appointments top the list of issues that people often raise with me. But equally, it will make it more likely that health issues are picked up quickly and dealt with earlier, for there is no better way to deal with illness than to prevent it. Addressing conditions early and intervening to prevent diseases from progressing prevents manageable conditions from becoming serious ones. It's good for patients and of vital importance for the future sustainability of our National Health Service. That's why our plan also includes £10.5 million to build GP capacity to intervene earlier and prevent illnesses such as cardiovascular disease. But this is not only an issue of money. We must also innovate and identify new ways of working. For example, I want to see the NHS Scotland Pharmacy First service expand so that community pharmacies can treat a greater number of clinical conditions and prevent the need for a GP visit in the first place. The third part of our approach is innovation to improve access to and delivery of care. Better use of data will ensure that more operating theatres are working at maximum capacity with best practice approaches shown to increase productivity by 20% rolled out across the country. Using existing capacity, more operations will be delivered, enabling us to deliver shorter waiting times. The latest innovations in genetic testing will be harnessed to enable better targeting of medications in cases ranging from recent stroke patients to newborn infants with bacterial infections. Smarter care, better care. Building on the already successful model of digital support for mental health, a service that saw 74,000 referrals in 23-24, we will offer support in additional areas, including dermatology and the management of long-term conditions. This type of care, because it is not dependent on physical attendance at a specific time in a specific place, is more flexible. It means care can be made to fit better into the lives of those who use the services. Again, smarter care and better care. And as a much-needed addition to improve patients' interaction with the NHS, there will be a Scottish Health and Social Care app. This digital front door will begin rollout from the end of this year, starting in Lanarkshire, and over time, it will become an ever more central, ever more important access and management point for care in Scotland. This is the third in a series of speeches I've delivered in recent weeks. In each, I've spoken about the importance of identifying clear goals, clear direction to national policy. If we have a clear sense of direction we wish to travel, the levels of success we wish to achieve, and if we can unite behind these goals, then genuine progress becomes all the more possible. Protecting, strengthening, renewing our National Health Service. That is a goal I think we can all get behind, a real focus of common purpose. If we care about Scotland's NHS, and we all clearly do, then let's commit ourselves to doing what it takes to get our NHS thriving once again. That requires action from me as First Minister, from my Health Secretary Neil Gray, and from my government. We can offer the leadership and direction as the measures outlined today seek to do. With Parliament, I can marshal the necessary resources to turn plans into reality, And believe you me, I will. From those with management and leadership responsibilities within the National Health Service, it asks for creativity, for passion, for innovation, for a renewed focus on what works, for a commitment to sharing best practice, and an effort to serve and support those staff most directly on the front line. For all our hard-working staff, delivering care, it asks, I am afraid, for yet more laps off the track. We see all that you do, all the responsibility that you carry. In so many ways, NHS renewal and recovery will be delivered by you, but it must also work for you. And for all of us who depend on the National Health Service and the wider healthcare system, at those moments of greatest vulnerability and need in our lives, it asks something of us too. It means accessing care at the most appropriate level. Last year, there were more than 1.5 million attendances at A&E. We know that many of those would have been better dealt with in another health setting. It is something that can change, and let's be honest, must change. And preventing ill health is not only about early access to health services, it's also about doing all that we can to live healthier, more active lives. Have no doubt, a healthier Scotland, and that means healthier Scots, is an important component, a necessary component of a stronger, more sustainable National Health Service. Our National Health Service is there when we need it. It is there when we come into this world. It is there when we are ill or hurt. It is there when we become parents and grandparents. And it is there at the end. No other public institution supports us with so much care through life's biggest moments. We must support it in return. The approach I set out today charts our course to do that. It addresses both the challenges and the opportunities. It sets the NHS on a path of modernisation and renewal. In doing so, it ensures that this cherished institution that has been around for all of our lives will be around for many more to come. And of the greatest importance to me, it will thrive in the years ahead. Thank you very much. Thank you very much for being here today. And what we're going to do now is take some questions from broadcasters, first of all, and then some questions from our friends and colleagues who are here today. And then I'll speak to the print media later on. So I'll take the questions from the broadcasters first to give those here some time to think about what they'd like to put to me today. So can I first come to Lisa Summers from BBC Scotland? Lisa.
First Minister, you said your government in 2021 said that it was going to increase capacity in the NHS by at least 10% to tackle waiting times. In 2022, you said that you were going to eradicate long waits for patients, yet we've got thousands of people waiting for a first appointment, perhaps over a year or sometimes up to 3 years for a first appointment with an NHS specialist. And we know that we know that productivity is less than it was pre-COVID. You also pulled funding from national treatment centres that were also supposed to tackle the backlog. So how can the public trust that the plans that you're outlining today are going to make the difference that you say it's going to make?
I think the public can do that, Lisa, because of the range of measures that I've set out, because the range of measures are not, they're not in any way fragmented. They are part of a complete package of measures, which are about, in some respects, reducing demand because of earlier intervention and by better support to individuals. In other respects, they are about increasing capacity and productivity and by changing the way in which hospital services are organised and structured so that we can reap the rewards of those improvements in productivity. So I'm not standing here saying to you that it's business as usual. I'm outlining an approach to reform which is about strengthening and improving the capacity of the National Health Service and to recognise the advantages and the opportunities that can come from the better support of individuals in the community and the earlier intervention that is required. So it's that combination of interventions that I've set out between the expansion of capacity, the shift of care into the community, and the greater utilisation of technology, which will help us on that journey. Can I come to Peter Smith from ITV News?
Thank you, First Minister. We're talking about health and social care here, and what I want to ask you is about something relating to the social care side of things, in particular relating to social services. There's a case in Glasgow this morning where sickening child abuse that was going on for years. The people who have been convicted are being sentenced as I speak. What we do know as well, though, is that social services were involved for a number of years. The abuse continued, and social services didn't alert police. It was someone else that eventually brought police in. What I want to ask you is that this case is not a one-off. As a human being, your heart must break, like it does for all of us, to hear that it's happened again. But how do you respond as First Minister, knowing that the very services, the professionals who are meant to be there to protect the most vulnerable children, have once again failed to identify and report this kind of sickening abuse?
The first thing, I'm not exactly sure what stage the particular case is at, Peter, so you'll understand that I obviously can't comment on live proceedings, but I'll obviously, in light of your question, I'll take a very close interest in the case in the course of the day to make sure I understand all of the elements. But where I completely agree with you, that it is essential, wherever there's any vulnerability for a child in any circumstances, that we act to address those circumstances, and that we rely heavily on people in the social work service and other professionals. You know, I know of cases where early learning and childcare workers are the ones who express a concern and raise a concern, and it is acted upon, because there is a duty on everybody in the public services to be attentive to the welfare and the well-being of children within our society. So the steps that there's obviously an obligation on public servants to report any concerns that they have. That's part of their statutory obligation. And these steps I would want to see in all circumstances taken seriously and taken forward in all respects. So I'll look with care at the point you put to me today, Peter, but I think it's clear from the other actions I've taken in government around, for example, the historic child abuse inquiry, where we have to confront these issues in our society. We can't, for any child to suffer is unacceptable. So we have to confront these examples and these experiences.
First Minister, if I may just follow up on that. Vulnerable children are continuing to suffer, even when they are on the radar of the services that they're to protect them. Are these services understaffed, under-resourced? Would mandatory reporting introduced as legislation in Scotland help protect these children from suffering?
I think I would contend that the mandatory obligation to report these issues, Peter, exists. My sense, my view of existing legislation is that obligation is carried by public service workers, and my signal would be that they should act and their concerns should be taken seriously. Now, these are obviously very difficult issues, and very sensitive judgments have got to be made by those involved. My sense, my experience, is that public servants are very willing to do exactly that. Can I come to Gordon Cree from STV News?
Thank you. We know there's an ageing population and the demands on the NHS will continue to increase. The innovation you've talked about will obviously address some of that, but are people going to have to accept that there are services the NHS provides at the moment that it's not going to be able to in future? And if so, what might they be?
I don't think that's got to be the case, but I do think people have to come to accept that services may well be delivered differently. And I think if you look at the history of the National Health Service, the National Health Service that was created in its original days is a very different proposition to the one that we have today. You know, I can remember meeting a constituent in the town of Alyth in my constituency who pointed to the, I'm going to call it the facility where they were born in Alyth. Now, Alyth is a town of about 1,500 population, and people were getting born in facilities. That's all changed. So, of course, there's been developments and adaptations, and that's going to have to carry on. So I suppose what I would say in response to your question, Gordon, is that I'm setting out my acceptance as First Minister of the need for us to engage in a conversation and discussion with the public about how services will change. Not that we won't get the services that we require, but we might get them differently. So if you take, for example, the digital dermatology service. Now, if you have an experience, if you've got a dermatology issue just now, you'll probably have to see your GP, get referred to, perhaps to a specialist clinic, see a consultant dermatologist, and you can hear in what I'm saying. You might even have to go somewhere to get a photograph taken of the particular issue you're concerned about, and all the rest of it. That's all good. That's many transactions involved in that. The digital dermatology service is currently today equipping general practices with the technology to enable images to be taken at GP level, for those to be considered and evaluated by specialist resources. Increasingly, I suspect over time there will be a degree of interaction in that activity by AI, and that people will actually get a response earlier to say there's something that that this issue is not something you should be concerned about, or this is something that we need to interrogate further and to explore in more detail. And as a consequence out of that, people could say, well, I'm not getting it the way I used to get it. I used to have to go blah, blah, blah. Alternatively, people are actually getting an answer and an intervention and an assessment quicker, which in circumstances like melanoma, for example, or worries about melanoma, the earlier you get a reassurance in your mind or the need for further intervention, the better. And so I think the point I would say in response, Gordon, is I think the delivery and design of services will inevitably change, but people's expectations of what they can be supported by through the different elements of the National Health Service. And I come back to how I answered Lisa's question. What I'm setting out here today is a programme of reform and renewal that recognises we have to motivate and mobilise a number of different elements in that process. Some in communities, some in acute settings, and some at home. And we have to make sure that works in unison.
Just to clarify very briefly, both your answer there and your speech talked about a bigger role for GPs. The thing people constantly tell us is they find it difficult to get an appointment. Will your plan make that easier?
Yes, because what it will help to do, what I'm making an appeal for today, Gordon, is a mobilisation of all of the different components of the health and social care system, where I'm recognising the cohesion and the unity that is required in all aspects of the contributions of the health and social care system. If we mobilise all of that in an orderly environment, what that will mean is that there will be essentially more areas to intervene in the circumstances that people face. And by its nature, that will reduce demand for GP appointments, and that will open up more GP appointments. Because I think fundamentally, people want answers and treatment. And they want engagement, answers and treatment. And we've got to make sure they get the engagement as early and as swiftly as possible. The last of the broadcast questions is Kieran Andrews from ITV Border. Kieran.
Thank you, First Minister. Much of Scotland spent the weekend reeling from the storm that hit a lot of the country over the weekend, but just now there's still 2,500 homes without power across the south of Scotland. 7 schools are closed as a result of either a lack of power or damage. I just wondered if you thought that there's been enough done to restore power quickly enough, and if there's any support that the Scottish Government will be providing to ensure that pupils not in school aren't going to miss out on learning, particularly in the run-up to prelims.
Well, on that last point, Kieran, on the information I have available to me at 8:45 this morning, there are 20 schools in Scotland that are planned to be closed today. And that represents less than 1% of the schools in Scotland, and some of them are primary schools, so the issues about prelims will not apply. But all schools should have available remote learning support, which is obviously a product of COVID, and we'd expect that to be deployed. Indeed, when my son's school was closed on Friday, he was very irritated by the availability of digital learning that was providing his requirements on Friday. Some of the schools, of course, have faced structural damage, and there will be a need for that to be repaired, and the Government will work closely with the Education Secretaries in dialogue with local authorities about those points. Now, again, at 8:45 this morning, there were 7,897 households that were off supply, 2,720 in the Scottish and Southern network, which is essentially in North and Central Belt, and 5,177 in the Scottish Power network, which will affect many of your viewers in the South. The scale of the challenge has been colossal, utterly colossal. So, although there are 7,897 people off supply, the number that have been reconnected is in excess of 180,000 since Friday evening. Now, on Friday evening, some of the conditions were completely and utterly inaccessible because of the risks to power workers. We've had numerous resilience calls over the weekend. I've been engaged with the resilience community and the power companies all weekend, and I'm satisfied that there has been a huge mobilisation of resource to try to address this issue. The problem we've got now is that the effort that is required today to connect 100 properties on Saturday would have connected 1,000 properties. So it's now a very diffuse problem across many isolated rural localities, which obviously takes more time. Now, there are discussions. I took part in a COBRA meeting with the United Kingdom Government on Saturday evening, and the Prime Minister and I had a conversation on Saturday afternoon about the situation in Scotland. The Prime Minister was reassured about the response in Scotland by me, and the COBRA discussion looked at the various impacts across the United Kingdom. The situation in Northern Ireland is significantly more challenging than it is in Scotland. So in the arrangements that operate within the power companies for the allocation of resources within the United Kingdom, where one bit of the country's got a storm, another bit doesn't, there has been greater priority given to Northern Ireland, and I make no issue with that, because the level of disconnection in Northern Ireland was at, I think, a third of the population at one stage on Saturday. So there's a complex amount of work going on there. So I'm terribly sorry to anyone who's without power. There's been a lot of generators put out, a lot of welfare vehicles out there, a lot of supplies in place, but the power companies are working very hard. And I think we have to acknowledge that for a large part of Friday evening and a lot of Saturday, many locations were inaccessible because of the dangers of the wind. But it's a warning to us that climate change is with us, and the ferocity. If you look at the rail map of what lines are still affected, you can see West Central Scotland is severely badly affected because of the ferocity of the storms. The rail network has done a good job in recovering services in most other parts of the country, but the west of Scotland, some of the damage is catastrophic, and they're having to go through immense steps to recover that, but I know they will do so. Okay, right, that's the broadcast questions over and done with. Can I turn to our guests and colleagues here to... yes, sir.
Hi, thank you, First Minister. My name is Jonathan Burton. I'm a community pharmacist practising near Stirling in NHS Forth Valley. It was really encouraging to hear that there'll be some additional support in place for our colleagues in general practice, and indeed that Pharmacy First will be subject to further development. It's often said that GPs and GP practices are the front door of the NHS, and I wouldn't disagree with that for a second, but it does leave me wondering sometimes whether that leaves me as a community pharmacist as the front gate, the ring doorbell, or possibly even the doormat. I would like to ask, with our increased role at the front door, effectively, of the NHS, and the development of the Pharmacy First service, and we've been especially busy through this last winter period. Can the Scottish Government give us some assurances around an increased urgency and focus on our postgraduate training and especially our clinical supervision, and also importantly wider access to patient records so that we can make our service as safe and effective as possible for the people in Scotland that increasingly rely on us?
Well, thank you, Jonathan. Rather than describe you as the doormat or the ring bell or the front gate, the garden gate, I would describe you as essential partners in meeting the needs of the nation. That's how I would describe the pharmacy sector. Because part of the message I'm setting out today is that if we are going to deal satisfactorily with the reality of the ageing of our population and the development of more complex needs, we've got to have more interventions, we've got to have more approaches, we've got to have more people lined up to provide the support that individuals rely upon to address their circumstances. And community pharmacy is an absolutely vital resource in that work. So fundamentally, we've got to listen and engage in discussion with yourselves. I know the Chief Pharmacist will do this, and the Health Secretary will be involved in these discussions about how we can take the practical steps to enable that to be the case. Now, all of the suggestions that you've made there sound to me to be constructive suggestions about how we can broaden and expand that scope of activity and involvement. So what I also want to signal today is the government is engaged in a very active process of dialogue with all interested parties to make sure that we maximise the effectiveness and the contribution of different components to the health and social care system. And the more we can address through community pharmacy in that early engagement and assurance, the better in terms of reducing demand on more pressurised, well, not more, other pressurised parts of the National Health Service system. But I view you very much as an essential part of that, and I know the Chief Pharmacist will be delighted to take forward discussions with you. Yes, up there. Yeah.
Thank you, First Minister. It's Rachel Cackett, Chief Executive of the Coalition of Care and Support Providers. Listening to your speech and your answers, there's clearly, I imagine, what will be very welcomed clinical reforms and medical reforms that are being set out today. And it sounds like that's on the basis of a contract with the Scottish citizens for longer, healthier and fulfilling lives. But obviously we only want citizens to become patients at the point when there is a defined clinical or medical need. I'm interested to hear a little about what you think the role of social care is in the preventative agenda before people need to become patients in that interaction with the NHS, particularly given the frailty of our own National Care Service at the moment.
I think it's fundamental, Rachel, and I recognise the centrality of having an effective social care system in meeting the needs of the population and in contributing to the overall health and social care system. So in meeting the needs of individuals, you know, I'm yet to meet somebody who says, I'd much rather be in hospital than in my own home. And so therefore making sure that we can support people and sustain their circumstances at home is critical. Now, I recognise the health and social care system is under huge pressures. I'm very familiar with the pressures in social care at local level, which is why in the government's budget we have, yes, given a record settlement to the health service, but we've also given a real terms increase to local authorities to enable greater investment between the health service and local government as joint funders of the social care system within Scotland. So identifying individuals who can be supported to live a healthy and safe life in their own home is a critical product of an effective social care system. But when I then focus on the role of social care in relation to let me call it the formality of the health service, the key point I would say that I recognise about the challenge of the health service just now is the flow of patients is not good enough. And so, we've got the order of 2,000 delayed discharges in our hospitals. That is, if there was ever a signal of what is the problem in the health service, that is one of them, 2,000 delayed discharges. So when I was at Forth Valley Royal Hospital a few weeks ago, just before Christmas, and they had very good elective throughputs of cases, but it was beginning to slow up because their elective sector was separate from the emergency care, but it was beginning to slow up because of the spillover of patients that required to be boarded in the hospital because of delayed discharge. So the social care system's got a crucial role to play in addressing that. And that's why we've got to make sure we've got a strong, well-resourced, accessible social care system that can meet the needs of individuals. Now that will have, as you will know, you're far closer to it than I am, there are such a wide range of different interventions that can be made available. What I hope comes out of my message today and the steps that the government is taking is that we can create a unity of purpose that we're all contributing through our different elements to addressing these challenges, and social care has got a fundamental role to play in that. Yes, I'll come to this gentleman down here.
Thank you, First Minister. I'm Professor Vasan from NHS Grampian, Research and Development Director, looking after the interests of the north of Scotland. While it's very important to look at the here and the now and reduce the waiting list, one must not also forget about the long-term access to clinical trials that take place in the UK for our Scottish patients to get early access to drugs, diagnostics and vaccines. The UK government has pumped in 100 million recently to establish 20 commercial research delivery centres, and you'll be pleased to know Scotland has 4 out of those 20, including one in Aberdeen. We have to quadruple the commercial clinical trials within 5 years. It's a very tall ask. One of the key pinch points is the availability of research nurses. Now, my crude calculation shows that if we have to scale up exactly by the number of patients, the number of nurses, we will be looking at an additional 2,000 nurses in Scotland. Now, this is clearly not something we can achieve, so we have to look at other ways in which we can provide. We could look at innovation through using AI, robotics to take some of the jobs that nurses do into a more digital platform. We can also look at health support workers, but we still are left with the problem that our nursing schools have to ramp up the capacity for research nursing and also health support workers who will enable the slightly more mundane tasks under the supervision of these nurses. This is out with the influence of any NHS director or any individual health board. This requires system thinking, which has the universities, the Scottish government and other sectors to work together. And I would love to hear your thoughts on how we can go about this and what is your vision on how Scotland can contribute and also generate wealth in the process when we do the clinical trials. Thank you.
Well, I think, thank you for the question. It's really an important issue because it essentially at its heart, it's about connections. So it's about how close are the universities to this research process. I'm delighted the principal of Heriot-Watt University is here with us today, and he can take this issue back to his principal colleagues, who I know will be keen to, because in all my experience of the universities in Scotland, they are hungry to be involved in collaboration on all forms of clinical research activity, and there's huge achievements that have been made in that respect. So I think the answer to all of this lies in that collaboration. I've made a plea today for whole system thinking. We've got to get away from compartmentalised thinking. We won't solve the either the waiting times challenge or the drug discovery challenge by operating in compartments. We will solve them in collaboration. And I know there'll be an appetite from the university community to work with you. The government is obviously very keen to support all aspects of research because going back to Stuart's point of introduction to this event this morning, this facility, yes, it's looking at a whole range of robotic activities, and yes, there's a lot of that associated with the health service, but there's huge economic gains to be made for Scotland. And you know, you'll never get the old finance minister out of me. I'm always keen to create more taxpayers, you know. So the more out of our health innovation we can create economic opportunity, the more that will flow into the integrated priorities of the government. So you know, we're certainly very happy to engage and to foster that dialogue with you. Come to the lady just there. There's just a lady that's waving there.
Thank you, First Minister. I'm Janet Monkman. I'm Chief Executive of the Academy for Healthcare Science. And I just have a plea that the healthcare science community are really keen to help with innovation, creativity, and look at numbers of different ways of being able to help with delivery. And it's a massive part of the workforce which is often not seen and not visible. Clearly, we're in an area today where scientists will have been involved, but there are many other areas as well. Thank you.
Thank you. And well, I think I'm keen to mobilise. I hope what you take from today, I'm keen to mobilise everybody, because to go back to the question that Gordon Cree asked me about how healthcare is delivered, I think we have to accept that healthcare support will be delivered differently. Innovation will drive that, and I've got to signal as First Minister that I'm prepared to embrace that and to make it happen. But I need others to motivate. I need others to be participants in that process, and your offer and your indication is very welcome. Just the lady behind you there, thank you.
Good morning. Thank you so much, First Minister. Sarah Redmond from the Health and Social Care Alliance. And there's so much to be welcomed from your speech this morning, in particular your recognition of the transport needs for people getting to in-person appointments, and also the emphasis placed on primary care and community health. There was a couple of points I just wanted to address. One is around the role that people as patients play in the reform agenda. Some of the things that we often hear from people, the two main frustrations sometimes they have are the frustrations around communication, two-way communication. You're quite lucky if you even know you're waiting, who are you waiting for, what is the exact kind of nature of the treatment. People are really looking for enhanced information and communication about their journey, their flow through the healthcare system. There's a huge burden of responsibility on individuals as patients. Aligned to that is that whole nature of feeling sometimes that they're cut into the particular symptoms that they're dealing with. So they have a huge burden of navigation to make sure that they're advocating for themselves, that they're able to, communicate if they're being told, well, this, you've exhausted this course of diagnostics around this particular symptom, where do they go next? There's a huge opaqueness at times with the health system that people are looking for greater clarity about. So I would say that making sure that we're working alongside people as partners, I think, they do a huge amount of that self-management that you've described, having to manage their own long-term condition, and they're looking for some greater partnership working often with the health service around that. And the second point really aligns to that, which is the huge wealth of assets that we have in our third sector that are delivering a whole range of health, both quite preventative support, but also some really specialist support, ranging from habilitation and rehabilitation for people with neurological conditions, people with sensory impairments, to some really great innovations around mental health support, recovery colleges. We've got so much innovation happening in the third sector. it is very much mobilised and willing to work on this renewal agenda, but at times it can be extremely difficult to do that. So I guess I'd be looking not just for your signal that you're willing, but I guess some of the mechanics of how do we go about that. So for both of those, how do we really make sure that we're mobilising the knowledge base and the skill set within our population, but also within the third sector? Thank you.
Thanks very much, Sarah. And there's a huge amount in there that's of interest to me. My response to your first point about the communications and the navigation is that, to me, the answer to that is that we need to have an approach that is person-centred. And it's my answer, frankly, to almost everything. When I look at the challenges that somebody will face around addiction, for example, needs a person-centred solution. It can't be a transactional solution that we can guarantee it won't work. So when it comes to that kind of wider question about how do we support people to be as effectively supported as they can be, person-centred approaches are crucial to me. And I'm driving that through the government's policy agenda in a whole host of different areas. It's central to the programme for government. It's the only way that you will get good outcomes within the available resources that we have just now. And we have to configure our approach to do that. Second point about the third sector is very important. Again, I come back to my core point in my message today. We've got to mobilise everybody to be part of this approach that we take forward. But we've also got to recognise that the means and the mechanisms have to be created to engage all of those organisations. And I think there will be so many aspects. The briefing last week from NHS Tayside about some of the performance that is involved there, and looking at whole system support to individuals in the management of demand. And the third sector was absolutely woven into everything within the community and the effective role of health and social care partnerships because of what those organisations could do to better support individuals. So now, some of that involves a bit of a culture change because, again, going back to some of the points I've made already this morning, if we just take the view that we can carry on as we are just now, then the challenge of getting greater third sector involvement will be all the more acute. If we recognise and accept we've got to do things differently, then culture has to change. Doors have got to open. Partnerships have got to be created. New styles of working have got to happen. But crucially for me, they've got to be wrapped around the individual. That's what I call person. And you used the words, Sarah. We've got to be working alongside people. I think that's a lovely concept. That, for me, sums it all up. Working alongside people. I'll take lady there, and then I'll take a gentleman up there.
Thank you, First Minister. Welcome much of what you said. As a former burnt-out NHS doctor who would love to go back one day, but I'm here. My name's Saoirse Hume from Cancer Research UK. The concern that we have is the widening health inequalities we're seeing in Scotland, and I know that reducing inequalities is, it's woven through the cancer strategy, and I expect we'll see it through this new publication as well. I guess for me then, it's specifically related to cancer, how we, when we have proven innovations that work, that detect cancer early, there's patient experience is improved, there are productivity and improvements in services as well. How do we ensure that they are sustainably funded and that every person in Scotland can access them? And the two I want to mention are the rapid cancer diagnostic services, which I know you've mentioned earlier, which we really want to see the Scottish Government fund across the nation so that no person is left behind, and lung cancer screening, which has been proven to be really effective, and the UK Government are rolling out nationally in England, so we don't want Scotland to fall behind.
Okay. Thanks very much. I think the point of inequality is fundamental to the agenda that's got to be taken forward. I look at the variability around the country, and it's not It's not in any way acceptable or defensible, and it varies too much. So an example such as the Rapid Cancer Diagnostic Service in the areas where that applies has been utterly and completely transformational. So therefore, the challenge that we've got to embark upon is ensuring that innovations of that type are shared and experienced right across the country. Now, there's a tension there, because you know, I will quite frequently, well, I have been quite frequently accused politically of taking a top-down centralising approach. What I make an appeal for, and that can be the criticism of doing exactly what you want me to do, but there's often quite a good argument for doing that to get a move on. What I'm trying to do in what I'm setting out today, and how the Health Secretary and I are interacting with the Health Service just now, is to give off and set out the strongest and clearest direction of travel, so that our boards around the country are mobilised and motivated behind all of that to make sure we can deliver the measures that address that inequality that you talk about. So please be assured that we will take that approach in how we take forward our steps. Take the gentleman there, and then I'm going to take this last question down here, and then I think we'll probably have to bring it to a halt. So, yes.
Thank you, First Minister. Ian Morrison, GP, I'm chair of the GP committee of the BMA. Now, very much welcome the emphasis on general practice within your speech, especially the funding restoration element, which has been eroded massively over the previous generation. That obviously has impact on access and the key part of general practice, which is continuity relationship-based care. To be able to realise a lot of the goals of your speech, you know, we will need more GPs. SNP did commit to 800 extra over the course of Parliament, but without the funding attached to that, it is very unlikely that that will be delivered, nor will it lead to a significant rise in GP whole-time equivalence, which we know is falling across Scotland. So does the First Minister and Cabinet Secretary have a plan within this new framework on how to boost the GP whole-time equivalence across Scotland? Thank you.
I think it's included and immersed in the proposals that we're setting out, and obviously we're taking a budget through Parliament which enables us to support that capacity. But I think we also have to see this in the wider context of how we are trying to take steps to strengthen and to expand the availability of a range of services to help to reduce the demand that is placed directly on GP interactions. And if we can mobilise that very clear approach and the clear communication, if I look at the experience over the Christmas and New Year period, you know, sort of a month from the middle of December to the middle of January, really clear communication about where people should go for assistance during a spike in the flu cases, which were of colossal proportions compared to last year, and even bigger than 22-23, sharpest, highest level of performance since records began in 2010. Generally, I would say that the evidence I saw was that people sought advice in the right places at the right time. So that, to me, is an indication that you can win these arguments with the public if you communicate them effectively and openly and engage in a dialogue with the public. And that's what I'm signalling also as part of what we're going to take forward today. Because if we do that, then we have the opportunity to reduce demand as it presents itself to GP practices, along with the work that we're going to take to expand the availability of GP services into the bargain. Now, I said one like, yes, this lady.
Thank you, First Minister. Hilary Munro on behalf of Allied Health Professions Federation Scotland. Thank you for your speech today and your renewed focus on early intervention and prevention. I'm here to represent 14 professions in the allied health professions, and as a collective, we work across practically all areas of healthcare, and we've been at the forefront of innovation and patient-centred care for many years. However, we still find it very hard to get round the right tables to be able to influence whole system change that we would like to see. Could we have assurance that we will be able to have that leadership and be at the right table so that we can help you deliver what you want and what the NHS needs?
Yes, and we need to have the right, if you take anything from what I'm saying today, please take that, I'm determined to get the right voices around the table, shaping, it's an invitation to the health and social care system and all of its components and diversity to work with the government. And I can't see how our health and social care system can deliver on the expectations on the public without us engaging in this conversation and taking the practical steps and actions that will address those circumstances. And that's what I am wholly committed to. There was a wee bit of controversy in Parliament last Thursday about a round-table discussion that I had at Butte House last week with a number of interested parties in the health service. I assured Parliament in somewhat, it was an exchange involving the usual kind of decorum of Parliament, you know what I mean by that. But there were many, many more round tables in Butte House as we work together to create this sense of purpose. So be assured, there's lots, there's lots and lots of interested parties. We've got together to get working together to create that sense of purpose, and the allied health professionals will be very much part of that. Now, I'll take this question from this gentleman at the very front, and then we'll call it a day at that.
Thank you, First Minister. Nick Mills. I'm a consultant in NHS Lothian, and I lead the data-driven innovation programme for health and social care. I'd first of all just like to thank you for your personal and positive message around the NHS in Scotland. It's so important to keep the morale of staff high at difficult times. It's not broken, it's challenged. I'd also just like to say I welcome your commitment to data. And data sharing in particular, to help us, help you transform the health service for the future. We need you to commit to getting our primary care doctors to share data about appointments, patient requirements with secondary care systems so that we can really join up and work together to get new pathways of care in the community. And it's 10 years we've been talking about trying to do this, and we still don't share that very basic fundamental information, which is going to be critical if we're going to realise your ambition. Okay, well, thank you. We've got to get on with these things. We've got to, there is an opportunity in the data that we collect and gather to learn important lessons from that and to utilise that to strengthen clinical practice. And there are many opportunities to do that, but I hear the point that you're making. And let me conclude on this point. You made a reference to the fact that the system is, it's not broken, it's challenged. I spend a lot of time observing the system, engaging with people. As I said in my speech, I spent a Saturday night during the Christmas and New Year period at the Royal Infirmary of Edinburgh. It wasn't a press visit. There was no cameras with me. I went there and spent time watching what was going on, engaging with staff. It was challenged. It was very difficult. I was very struck by the degree of responsibility and obligation that individuals were carrying, but they were determined to carry it because they wanted to change lives for the better. And I think it's that sentiment that we've got to cherish and nourish at the heart of what we do in the National Health Service, and that's what we're very fortunate to benefit from. So you can be assured that that approach and that recognition will lie at the heart of the approach and the response that the government takes forward. So to everybody, thank you so much for being here this morning and for giving me the opportunity to reflect on the issues that you've raised with me, and also to set out the direction of travel in leadership in the National Health Service that the Health Secretary and I will take forward, and you have my absolute assurance that it commands my attention to make sure
that we deliver for the people of Scotland and deliver for the health and social care system in our country. Thank you so much.